Hey guys, how are you doing today? If you ask me, I think I'm doing pretty much good, whereas when compared to the past few weeks and compared to last month, of course, because last month was tough, but since February, I mean, I'm doing pretty well. And I'm glad that, my backache that I was suffering from, that has vanished. I did nothing except a very good massage. So I'd call this girl, who does the back massage, and she did that. And I think after that I relaxed a lot, and after that I felt good. I felt good. So I think what I felt is the reason behind all that might have been that that I did not take rest. So as I mentioned in my previous video, resting is very essential after you take your rituximab dose. Now, one thing that I forgot to mention in my last video was that when I visited Dr. Bhatia this time in AIMS, I had written down a couple of questions, that I wanted to ask him. But when I actually met him, it was so late, and I had been waiting for couple of hours and I was already tired, right? But still I managed to clarify my doubts, and I managed to ask him some relevant questions which was related to rituximab, and that's what I'm going to share with all of you today, because I feel that the questions that was lingering in my mind, I'm sure you guys might also be thinking about the same. So the first question that I had in my mind was, till how long do I have to take this? I have been taking rituximab since 2018, so which means it's been a little above 6-7 years, right? So I asked him, how long should I be taking it? To which he said, what is the problem if it is benefiting you? Is there a problem? If there's a problem, if you say that you don't want it, then we'll see what next can be done. To which I answered him that no, I don't have any problem, because if you ask me, I've mentioned it, right, that rituximab has been keeping me attack free. So if my doctor is fine in continuing with rituximab, I don't have a problem. And that's what my first question, which was answered. The next question I had in my mind was, to be eligible for rituximab, doctor will always ask you to do a CD19 and a 20 blood test, right? And till the time the report says that the percentage, the B cells, it's a B cell marker, right? So till the time the percentage is 0, your doctor will never ask you to take rituximab, right? Because it means that it is not needed. But the moment it increases and it goes beyond 1%, your doctor would just ask you to take rituximab. So my next question for him was that, what increases? Because my CD20 report suggested that my percentage was above 7%, which was way high than what was actually needed to be. So to that he said, do you expect the medicine to work forever? So I got the answer. So he said that when you're taking rituximab, the dosage, the efficacy of the medicine is up to certain amount of time, right? So maybe rituximab lasts for like 6 months, and hence the doctor suggests that you do the blood test, the CD19 and 20 test, after 6 months. And because in some it might last longer, like even 10 months or 12 months, and in some the percentage might increase when it goes beyond 6 months. And mine, I had taken it last year 2024 in March, and this year I did my blood test in January, so it was already like 11 months, 10 months, right, to be precise. So maybe 10 months is not good enough for me. Maybe I have to do this particular test in 6 months, I guess. That's what I'm thinking, and that's what the work for me, so this time after 6 months I'll do my rituximab, CD19/20 test to check if my report is in place. So so these were the major questions, and in fact I had written like almost 20 questions, but I did not get that much of time because there were a lot of other patients also, right, inside that room. And other thing I wanted to check with him is like, does alcohol in any way affect? I mean, I'm not an alcoholic any by any means, but I just wanted to confirm, right? That sometimes, okay, I mean, I admit that sometimes I drink. I mean, not regularly, but in office parties and office gatherings, and sometimes just catch up with friends, right? And I was just wondering, maybe because of the alcohol intake, it might have been higher. That this report did not come out to be good. So I just checked with the doctor, and to which he said, we don't know. That was his answer. Like, it is not it's not suggested. So the answer was that we really don't know if alcohol affects it or not. But then the answer was that we don't know. And I really didn't want it to take any chance, because it has not even been 2 weeks of me taking the infusion, right? So yesterday, when I had this office gathering, and I was telling the bartender, just make me something non-alcoholic, and I had all my colleagues asking me, what are you drinking, what are you drinking? And I had to tell them something non-alcoholic, but that's me taking precaution, right? So I mean, and I don't mind taking precaution. I mean, it's okay, it's not even 2 weeks. And I don't want to be just impulsive enough to go ahead and do what everyone is doing, because nobody knows my condition besides me, right? And I haven't been vocal enough to express it with everyone, at least from my office, and I would like to keep it that way, right? There's no point in gaining sympathy from anyone. That's what I believe. So I've not shared, or I've not disclosed it with anyone except my boss, my reporting manager. I think, yeah, that was it. So good job done for yesterday, I guess. I really did not touch alcohol, and that's how I intend to keep it this year, at least. And I want to, actually what I'm trying to do is I want to see if it really affects or not, because as per doctor, there's no study, right? But at least as a patient, I can gauge it for myself, right? What happens if I don't drink? Will it last longer, or will the impact not make any difference? That's what I want to gauge, and that's what I'm trying to do with this time. Yeah, so those were the kind of questions that I asked him, and even though I had a lot of it, but yeah, these were the major things that I could ask from Dr. Bhatia, and I think it helped me to give me clarity that I need to do my test every 6 months at least, to understand where I land, where I am standing at that point in time. And I hope these questions which doctor has answered, that's what I've conveyed it to you, and I hope it helps to you too. And thank you so much for watching the video. Take care, and if you haven't subscribed, kindly do go ahead and subscribe, because when I go ahead and see my channel, I guess the non-subscribers is very high, like more than 80% who watches my video are non-subscribers, and just 20% are the subscribers. So for those non-subscribers, it would be really, really helpful for me. It will be motivating for me if you go ahead and subscribe to it. Thank you so much for watching. Take care. Bye bye.